So what are some of the reasons for the need to change or discontinue treatment? And in these situations or scenarios, how should clinicians approach patients and their families? And what types of discussions are had when talking about changing or discontinuing treatments?
Yeah, I kind of start. One of the key reasons really for treatment change or discontinuation is really intolerance or significant side effects. So if a patient develop either significant side effect from the medication itself, or it is from a procedure that's associated with the delivery of the treatment, like the lumbar puncture for listeners. And another point also to keep in mind in terms of the change in therapy is really is disease progression despite treatment. And so while we're still answering the when to do it, it is important to remember things if there is more, if significant loss of motor milestones, if the patients had increased respiratory support, and so on. There are also other situations that could be pertinent to the adult patient population if there are reproductive concerns or if there are pregnancy that might also lead to discussion about therapy change.
Yeah, I don't have too much to add to that. I guess similar considerations occur even in the pediatric population. I will say one maybe difference is, and I think this is perhaps the area where there's still an unknown is because in a young child especially, they may still be acquiring milestones, and so you're trying to understand as well if there's a delay in motor development. Is it due to the underlying disease despite response to treatment, or is it because of ineffective response to treatment? And that child is still sort of a moving target, especially when we're talking about in those first few years of life. So that can be sometimes really tricky to understand. Is it an incomplete effective treatment, or is it, again, as we said, the disease starts long before you really have symptom onset? In some cases, even studies showing even before birth, especially in some of the two-copy SMN2 babies. So it is very possible that there will be some motor deficits as manifesting as a delay, for example, in achieving a certain milestone, or in a subset of those in babies, even when dosed early in life, with not achieving some of the milestones. Again, some of that does drive back to age at first treatment initiation, et cetera. But this comes up frequently when we're talking to families. And so we think about, especially, I'd say, when we might consider more urgently changing a medication, at least in the young pediatric population, especially if there's a loss of motor milestones. So I might expect that some of those babies may be at risk again of delays in development. But I'm hoping not to see a loss or a regression in milestone when they're on an SMN dependent therapy. And so a potential decline maybe, or again, as Bakri said as well, if there's sort of a thought that there's worsening of disease status, progression of disease, these may be reasons that jointly, families and the clinical team may think about a different therapy, as well as, again, related to tolerance to the medication, as he said.
Yeah, this is really great, and one of the other points that was came out from the document is really as to how long you should be on a treatment before you make the change. And Diana clearly mentioned the points where there is an urgent indication, and that's really when that urgent indication is there because there was a decline or a loss or intolerable life effect or so on, then the change is needed. But based on the guidelines or the assessments for a treatment goes anywhere between 6 to 12 months before changing. And the idea and more for the adult patient population is probably the longer period of time is up to 12 months is the fact that the natural history as we know it, that is the changes tend to be more gradual and it takes time to manifest, and that's also based on the expectation for what the treatment is going to show, particularly if you wanted to see some stabilization of treatment. And so quick change between medications, particularly for the adult patient population or those with long-standing disease, unless there is an urgent need to do that, like a loss of a milestone or major side effects, is usually waiting anywhere between 6 to 12 months or so.